Well, good evening. I would take a moment to welcome all of you to our first ever Flivver Direct, intended on informing parents and students and the public in general about the essentially how we're planning on returning to school in actually just a couple of months. I know that there's a lot of questions out there. There's concerns. There's a lot of unknowns. And the goal here is to start the process to get people feeling comfortable and confident as to how we're going to approach school in just a couple of weeks. I'd like to acknowledge a couple of people who were instrumental in putting our plans together and working through a lot of the difficult decisions along with our health department, Carrie Musin, Julie Kootware, our school nurses, our administration, and really the health department's been instrumental in helping determine what the best route is to start school and being consistent with the return to school roadmap that we had that came out just a few months ago. Just to backtrack and catch you up to speed as far as how we evolved to where we are today. Back on June 30th, Governor Whitmer passed an executive order 2020-142. And that requires all school districts in the state of Michigan to come up with a preparedness and response plan to address how we're going to open up school in the fall. And this plan is defined or built from the return to school roadmap that was put out by the Michigan Department of Ed in the state. And this roadmap helped us design what this preparedness plan is going to look like in three different categories. The first category is phases 1 through 3 in the roadmap. And those phases equate to students not being in the school building. All instruction would be done remotely in these phases. As we get less aggressive or less intense, phase 4 allows for in-building instruction. And there's lots of lots of considerations to make sure that we keep kids and staff in the community safe. And less restrictive as we go up to 5. And then phase 6 is basically back to normal. I'd like to go through a little bit through the preparedness plan with you. And this is not an end-all. The preparedness plan is basically the safety piece of returning to school and some of those types of details. And there'll be other considerations that we'll talk about a little later on that's not necessarily addressed to any detail in the preparedness plan, but are critically important for opening school and getting kids and students and teachers, faculty, staff back in the buildings. So I'd like to go through the 10 phases or the 10 steps of the preparedness plan that we do address, followed by some of the really important considerations that we have outside of that plan, but inclusive to our general plan, and then talk a little bit about what's the next steps and what we will do from this point on. And really, the most important things that we have to consider, that we do consider, is the safety of people, the safety of our kids, our staff, and planning very carefully how we go about re-entering school in just a few short weeks. So I'll go through these 10 steps. I'm not going to go through the details of these steps simply because I will be emailing these out and the plan will be on our website. So to go through the specific details might be a waste of your time. I'll hit the main points. I'll hit what I think the biggest questions are, and then we'll work through the rest of the conversation with things that we have considered outside of this specific preparedness plan. The first piece a lot of people ask questions on is the personal protective equipment. We are in phase 5 of this plan. But we're going to assume most of the required elements of phase 4. We feel that it's incredibly essential to be as safe as possible to get a little bit even deeper, deeper restrictions than required. And then we can back off as things open up, and we have systems in place that require less constraints. So we're going to start off really careful and with a lot of precautions. So as we return to school, everybody will be required to wear masks. That's all staff, all teachers, all students, while in the buildings. But the nuance for elementary school is that students in kindergarten through 4th grade will not be required to wear masks while in the classroom, as long as we keep these cohort groups or students moving within the same group and not intermixing with the general population. So we are going to require masks. And again, this is the start to school. We're going to be restrictive, and it's important that we follow those procedures, those precautions, with the understanding that things can loosen up if the circumstances change to the better. Hygiene, the second point, the second category, we're going to teach hygiene at every grade level, from washing hands to sneezing to coughing, sanitizing, staying safe with regular hand washing, and just an understanding of how germs are spread. And with that, we're going to encourage students and faculty to keep their hands washed and use all the precautions that are recommended by the experts in the medical field. Spacing and movement access. We're not going to across the board do the social distancing of 6 feet within all classrooms. We're going to strive the best we can and to what's reasonable to be able to distance to a reasonable distance, but we can't physically get to 6 feet everywhere. But we will have masks on, and we will be doing everything we can within the confines of the classrooms to make sure we're distanced at appropriate levels. We will allow backpacks in classrooms to start the school year, because we're going to be limiting the time students go to lockers. Students will not be going between every class in the secondary level back to their lockers. So backpacks will be permitted, and students will be expected to carry the belongings for the contents for the first few classes, and then we'll have staggered rotations back to lockers to refresh their backpacks. So expect to bring backpacks, expect to follow signs and on the floors and on the walls. We'll have restricted directions that people walk, and we'll have reminders for hand washing and for distancing and for all the other factors that are deemed to be safety precautions. We're going to be staggering passing times by grade levels at the secondary level, by classrooms at the elementary level, and we're going to do what we can to ensure that kids aren't crossing paths as much as possible between classes in the hallways and in those instances where they're coming to and from school. The next category is screening and responding to symptoms. We're going to rely on the health department very closely for guidance in this area. We will have nurses on hand at both the secondary and the elementary grade levels. Staff will be expected to screen daily in a self-screening methodology, and parents will be screening students with protocol that we'll be sending home, and there'll be an expectation to screen on a daily basis. We will not be taking temperatures of students or staff collectively at school during this next school year. So it'll be the responsibility of parents to take temperatures and to provide that precaution as far as a parental screening protocol. We'll have designated quarantine areas for students and staff who are ill or suspected to be carrying the virus. And we'll have those located in proximity to the nurses' stations. And we'll separate that from the general flow of the school while in session. Testing protocol, obviously it'll be dependent upon the circumstances. When students or staff or anybody that attends school is tested or is confirmed as positive, there will be contact tracing within the school provided by the health department, and we will follow their protocol depending on the circumstances. But we will be addressing the close contacts and those types of situations where we deem necessary. And we have a lot of questions about what happens when somebody is test positive in a classroom. It'll be a little bit different between the elementary level and secondary level because the contacts obviously are going to weigh less at the elementary because of the cohorting, and a little bit more, I guess, broad at the secondary level. So it'll be determined, it'll be dependent upon what level the student is at, secondary or elementary, among other circumstances such as Voc Center and other areas where students may be leaving campus for educational experiences. Food service, I can tell you I'm very confident. We are very good at what we do in this area. They've been practicing the last spring when we closed and all summer, delivering meals in alternative ways. We are in the process of securing tents and other equipment to spread out people during these warm months. And that'll be the critical part is keeping people distanced and spreading out those meal times, so we have minimalized interactions and mixing of students from various classes. Athletics or other gatherings, we will be following the MHSAA guidelines for that, for sporting events, for attendance at sporting events, for practices, and for events. And that will be outlined as we progress from the Michigan High School Athletic Association. Category 8 is cleaning protocol. And that we are in the process of getting equipment and sanitizers for the deep cleaning that will be occurring when school's not in session, and the frequent cleaning of frequently touched surfaces, and the cleaning of desks and other items of that nature between every single class. Busing and transportation. We increased the number of runs we have to reduce the number of students on each bus. We have 14 runs, and they will all be uniform this year. Students will be expected to wear masks, and we will board back to front, and there will be assigned seats, and they'll be assigned by the stop or by the family. So we're going to do what we can to ensure that there's not a lot of mixing of students on the bus that aren't together at different times of the day. Lastly, as far as the plan, the broad sense of the plan, they're medically vulnerable students and staff. These will be case-by-case situations when there's people that have underlying conditions or require a different environment. We will make sure that we provide what we need to provide to keep all students, all staff safe in the environment when they do arrive at school. I just hit the highlights of the preparedness and response plan through the summary. That a copy of that summary was emailed a few weeks ago to all parents. I want to touch on other things that come up that have been asked about, that people are wondering about, and important considerations that we have above and beyond the basic plan that we submit to the state prior to the start of school. One of the big, I guess, questions that people have, that parents have, is what should we do this year for instruction? I understand completely there are folks that are concerned about coming back to an environment such as a school where there are a lot of people moving parts and just closer population than you may be used to over the course of the summer. And I also understand that there are a lot of folks that are eager to get back in the swing of things in the classrooms and see friends and just have that school culture. So I get both ends of the spectrum, and I'm sure there's people that are waxing and waning as far as what is right for me. I think we're fortunate enough to have a few very good options for kids and for families. And when planning through this over the summer, we wanted to set up different scenarios or different options to meet the needs of all students. So I want to go through and explain the three options that we have for instruction. And again, this is designed to get us started into the school year with the understanding that there's a whole spectrum of conditions and thoughts and feelings and beliefs about coming back to school. So as I walk through these, I'll be getting into a little bit more detail. The first of it is face-to-face in-person instruction. I consider that our bread and butter. I'm getting the faculty back in the doors is really an important aspect to education, and getting that whole sense of the socio-emotional piece of education, the academics, the social pieces. It's really important for those that are ready to and want to come back in person, that you understand what processes we've gone through to provide a safe environment. And there's other situations where there's students and families don't intend on coming back in the immediate or near future. For that, we have the virtual option. And this is a long-term option that students and families can select. It's an anytime, anywhere concept, not bound by school day hours. The virtual option is obviously online, and it reaches the same grade level and content standards that our in-school option offers, but the instruction looks a little bit different. It's not the same teachers, and it's not the same format. But ultimately, the content or the instruction, the standards that are hit, are consistent with what goes on in the buildings. Our third option is the distance learning option. And I consider that the sprint. That's the option I feel is most important for those that are leery of coming back in building, but will as soon as they feel comfortable, as things open up and as time goes on in the near future. This is that option where we're starting it and we're going to evaluate the process every 9 weeks, at the elementary school every 12 weeks, to see where we are with this pandemic and where we are with providing this option. This is real time. This is students actually in their classrooms that they'll be in upon returning in a distance fashion. And it's a short term. It's the ticket back in the classroom, so to speak. It's that short term time where students are actually instructed by the teachers that are in school, in the environment, and then allowing students to come back at that same pace as the other students that are in school in person. This option is open for K through 8th graders, and at a very select circumstances at the high school level. And it's akin to the Zoom format. And the reason it's developed for K-8 is we're going to be cohorting at those grade levels. The same groups of students are going to be traveling in the building or in the classroom together. So we're not mixing students amongst the whole school. We feel that will provide us those classrooms where we can provide the distance learning in an effective manner, and provide students that are at home that option of being at home while maintaining that relationship inside the school and inside the classrooms. Very soon we'll be sending a survey out to parents, getting a feel for where you are at as far as which of those 3 choices you're going to be starting the school year out with. We're going to ask that we have a decision this week. The parents, if you are planning on a distance learning environment or a virtual learning environment, that you do contact the school, preferably midweek, but this week, so we can start planning better for how we're going to open up and how we're going to offer these programs that I just spoke about. Other information I will be sending out is health department flow charts to answer a lot of those questions with, as an example, what do we do when a student tests positive, when a staff tests positive? How long are we out for? Which can be individualized. So I'll be sending some literature home via email, and you can look through that literature, and when we return with another edition of this format, I'll be able to answer some of the questions that still exist. I don't know if I covered everything that people have questions on at this time. A couple other things I'll just hit on. It's an informal format, and I get that. As far as guests and visitors, once school starts, we are going to be keeping guests and visitors in the buildings to a minimum, and we will be when you do arrive, it'll be for specific reasons, but we're going to keep that very limited. Other things that we are considering or have considered and will be prepared for, depending on circumstances, is schedule options, staggering the starting times, ending times of different buildings within the district. So to stagger bus routes and get more constricted or more confined if that need arises. We'll have those options ready to go, but we want to right size and make the environment that we provide as restrictive as necessary, and still provide that total quality, that high education that you're expecting and we're accustomed to. I'd like to go over some questions now that have been asked, and these are lumped up. These aren't specific questions. So one topic: students sick with other symptoms other than COVID symptoms. What happens there is it's the normal sick day, the normal process that we do use. We want to encourage, and that's a good point. We want to encourage students attending school, but we also want to make it a very, very concerted effort and a point to stay home when sick. We will be broadening our attendance policies and understanding that with the current circumstances, there will be more absenteeism for these reasons, but we certainly want to encourage and provide that platform for students to stay home when there's illnesses, and the non-COVID type of symptoms will be treated like normal. Another question. If a child is sick, I'm sorry, Mr. Cowan wrote the questions down now. Okay, the next question: recess for EK 8th graders. I know that Woodland, Mr. Petch and I have talked deeply about how recess will be held. We plan to flex times. We're exploring that option to flex time so classrooms go out together, but grade levels don't necessarily go out together or combine during those recess times for the start of the school year. We're going to designate areas for grade levels and for classrooms for recess, so kids get a chance to get out of the classroom outside, but maintain that safety piece of it, and also understand how the equipment is being used, the playground play areas, and make sure that we have an opportunity to clean what's being used. Quarantine procedures. There's been some questions on what happens when students become ill. We will have quarantine areas. We have incredibly well-versed nurses on site. We will have our teachers and our staff understanding the procedures to take to get kids to quarantine and follow those processes. We'll have the health department supporting in situations and in circumstances that there's issues with COVID-19 or suspected issues or possible issues. We'll have the right people and systems in place to address these items. How do you pick, how does a family pick in-person, distance, or virtual options? That is specific to the family's needs, interest, and comfort level for returning to school in person. I can tell you, I can talk about the virtual choice being out of school, and receiving a high quality virtual learning option, hitting all the standards for grade levels and subject matter. Distance learning is that, as we talked about, it's that gateway back into the classroom for those families that want their students in school, but not necessarily at this time. That's that ticket back into the school district and jumping in without a lot of backtracking or being on target for the classes that they are taking. Busing we did talk about. Will special education and other services still be available if a student does distance or virtual? Those options are still available. Special education is still available, and food service is still available, and with the distance and virtual options. Students that have IEPs will still have their IEPs activated and followed. But the best answer, the best protocol is to call the office that your child is in and talk through the specific options or the specific services depending on your circumstances, because really everybody's circumstance is a little bit different, and I can give you general terms what will happen, but more importantly, talk to your respective building principals about the options that best serve your family's needs. The next question, can you transition from virtual back into the building? Yes, you can. The virtual transition, we encourage that to be at the semester time, because there is a difference in instruction or timing of when standards are met. We believe that transition at a term's end and the start of a new one is the best fit for the virtual method. The distance learning, on the other hand, is more of that sprint that I talked about. It's when comfortable, getting back into the building is an option at any given time. Any more questions, Mr. Cohen? That looks like it right now. And I apologize for the choppiness of trying to walk through this. I'm trying to decide on what may not be known at this point and what is already known. We have sent some previous information out. We sent the preparedness and response quick reference guide, the return to school roadmap, which was a link. We sent the reopening plan video and various building level updates and items specific to buildings. I'll take the feedback that I had trying to broaden this to hit the whole audience and fine tune and hit some of the more concerning or more items that there's more questions on as we progress closer to starting school. This was a first attempt to try to bring everybody into the same experience and to provide an update on where we are as a district moving forward. And I guess at this point, I can say that decisions that have been made and the path that we're going is based on the conditions of the UP, where the COVID-19 is in relation to incidences. We're relying a lot on the health department, their recommendations and suggestions, and the My Safe Schools 2021 Return to School Roadmap. We're making decisions not necessarily based on what's popular or what people like. We're basing our decisions on what we feel is the safest, the most complete route for a quality education and to keep kids safe, to keep students safe, to keep staff safe, to keep the community safe. and not necessarily what's popular. I consider this the sprint. I consider the methodology that we are starting school not to be permanent. But we are working towards getting and implementing what we need to do to get back to school, so then we can evaluate where we are on a continual basis. The things I've talked about today aren't the way we do things in the future, but they are currently the way we are doing things to start school, with the understanding that this is very fluid. It's subject to change as circumstances change. And it's our job to make sure that we're on these changes, and we always keep the best, most appropriate conditions for our environment that we can, based on the circumstances that are presented to us. So I appreciate all of you being here and listening, and I will be putting some information out as things change, and opening up this another time for another session where we can update and get folks comfortable and confident for returning in just a few short weeks. Thank you very much.